All right, as we've been telling you, the Senate Finance Committee is looking at more than 560 proposed amendments to the so-called Baucus bill, several of them coming from my next guest. Orrin Hatch is a Republican, of course. He's the minority power player in the Senate, so he probably doesn't expect his amendments necessarily to get very far. You never know, though. He wants Washington to step back, take a deep breath, hit the reset button, and that's kind of what your amendments are about, right? Watch the costs, guarantee the savings, that sort of thing, right?
Well, they really are. First of all, we can do insurance reform. We can make sure that people with pre-existing illness and injuries, are taken care of. We can certainly make it so that small businesses can get together and unify so that they can get the same prices that big corporations do. We also need to recognize that each state is different. Utah is not Massachusetts, and yet they're trying to impose a Massachusetts-type plan on Utah, even though Utah has one of the best healthcare systems in the country. Medical liability reform, my gosh. I can tell you that I know it's costing us an unnecessary defensive medicine. Doctors just defending themselves by having their histories filled and replete with all kinds of tests and other approaches that really cost an arm and a leg. I think it's somewhere around $300 billion a year in unnecessary defensive medicine that we could use. One thing I wouldn't do, I wouldn't take $400 or $500 billion out of Medicare in order to pay for this when Medicare is $38 trillion. That's with a T, T-R-I-L-L-I-O-N, dollars in unfunded liability. And I could go on and on. The fact of the matter is each state is different. Each state has different demographics. If we give the money to the states to solve their problems the way they want to with their demographics, almost every state would do a much better job than one-size-fits-all federal government.
So where is this going, Senator? You heard at the outset now that the CBO has scored the president's savings for those who participate in Medicare Plus, that they're not going, or Medicare Advantage, they're not going to be seeing benefits remain as a constant and the same. They're actually going to see those benefits cut. Now you've got all these amendments added on here. If you had to handicap the prospect of health care reform happening this year, what say you?
Well, in the Finance Committee, they're trying to ram this through. They're talking about going to 11 tonight, all day tomorrow until 11 tomorrow night. Look, this is 1/6 of the American economy. It ought to be deliberate. And do you realize that this is a conceptual bill? We don't even have the final language. It's hard to even know how your amendments fit in this particular bill. And by the way, the Congressional Budget Office can't score this. Now, why in the world would we be expected to come up with a final bill that we don't even have the language to as of right now, and that we can't get the scores? And the chairman, Baucus, almost had a fit when the head of the Congressional Budget Office said it would take 2 weeks to get the scores on some of the things that he wanted. Look, let's take our time on this.
So you're saying, Senator, that with the fact that the budget director has at least scored the Medicare cost component of this and said that the president's way off, was that a deal killer?
Well, it should be, because the president said he is certainly not going to, sock it to the middle class in any way, shape, or form. But think about it. There's $300 billion that they're in new excise taxes, everybody from insurance to medical device manufacturers to clinical labs. That's all going to be passed on to the consumer, and that includes an awful lot of people in the middle class and lower than the middle class. You've got $27 billion that they're going to have. They're going to sock to employers at a time when we have double-digit inflation, almost double-digit inflation, and employers are in real trouble right now, and they're going to do that to them. And then you got $20 billion in taxes on a new mandate on families. I mean, they're going to sock it to a family that earns $66,000 a year, $3,800 if they don't take a Washington-governed plan. I mean, that's ridiculous.
All right.
And why should we be pushed in this direction in this very, very bad way and not do this in a decidedly good way?
Okay. Senator, I think the double digit you were referring to was close to double digit unemployment, not inflation, right?
Well, I'll bet you money it's double digit right now. But even if it isn't, it's 9.6, 9.7%. That's pretty darn close to double digit.
Okay.
That's right.
Senator, good seeing you again. Thank you very much.
Good to see you, Neil.
All right. Well.